All right, we're just going to take a minute as everyone populates from the waiting room into the gathered space here. Good evening, everyone. We're just going to watch those numbers climb. Thank you so much for being here on a Tuesday night. Thank you for caring about this profession so much that you're willing to keep working another hour so we can all figure out the best way to advocate for this medicine and our patients. And there's some stuff we need to talk about tonight. We've got a lot of folks here to talk about it. And we're really interested in your feedback and your questions. We're not going to have time tonight for every question, but we want to take them all. We might not answer them all. So, okay, it looks like everyone's populating. It's going to keep growing as the meeting goes on. I'm Ra Adcock. I'm the executive director of CSOMA. Thanks for joining, and go ahead and log in. Where are you calling in from? We love to keep connecting in this community. So if you're willing to throw in, is the chat enabled, Kim? Can attendees do it? Yeah. So you're welcome to put questions in the chat as well as, hey, where you tuning in from? And then we also have, do we have the Q&A open? Is there a Q&A or just the chat tonight? I think just the chat.
Yeah,
And,
Q&A is open.
okay, and the Q&A is open too. So put questions in the Q&A, put your questions in the chat. Timely questions we're going to take right away, and more complex questions we're going to take towards the end or even follow up on afterwards. Okay, with that, we have almost all of your CSOMA board here tonight. Not quite everyone. There's two people, one or two people missing, but we have everyone else here. I am going to go ahead and share some slides, and we're going to take those together and learn a bunch tonight and basically figure out an action plan that we need to take as a community to best protect this medicine for ourselves and our livelihoods, and most importantly, for our patients. Yeah, Carmen, great. Thanks. Come on in, everyone. Tell us in the chat where you plugging in from now that the chat's enabled. And I'm going to get these slides shared. Here I go. All right. Here I go a little slower. Things slow down at 7 p.m. Here we go. All right. So we've got a lot of the board members here tonight because this has been a team effort. Your CSOMA board, everyone here is working so hard to attend the CAB meeting last week, to lobby in Sacramento last week. We are taking meeting after meeting with state legislators as well as other organizations and other stakeholders in the profession to try and figure out how to navigate this year's legislative session. So here are here's your board, your CSOMA board. We're so honored to serve you. And just to keep in mind, we're not CSOMA. All of us are CSOMA. We're just serving as your board members right now. But just like a labor union that has focuses on slightly different things, the union is the people that make it. CSOMA is the community that makes it. Everyone here tonight is part of the CSOMA community. We hope you're also a CSOMA member, but whether you're a member or not, you're part of this community. Thank you for being here. We're happy to represent you and do the best we can while we have a seat at the table. So we are a 501c6, just to make sure you all realize we are a nonprofit. We don't have a big budget. Our budget comes mostly from our events and your membership dues. And with that, we attend state and national meetings. We lobby in Sacramento. We attend CAB meetings, and we hopefully provide what feels like amazing and affordable education. And our whole goal is to advance this medicine, the professional standards, the public safety, the public awareness. We want to improve your jobs, make your life better, and create as much access as possible for patients to this amazing medicine that we are so honored to share. So here's just one of our events we had, and so many members in this, and some of you in this picture in the audience tonight, or in the audience, in the crowd. You're not an audience, you're here to be active participants. So are in this collective tonight. Thank you so much. We want to see your smiling faces. This is how we resource in the profession and keep going, is by coming together and connecting. So thank you for doing that tonight. I'm going to turn it over to Kim Newman, CSOMA's longest running member, staff and, a board member, and our marketing director now. So thanks, Kim, for being here.
Yes, thank you. Thank you so much. So just a really quick update. Very excited about this because we used to have so many different types of memberships and it was quite confusing. And now it's simplified. So we have a student membership, $35 a year, and then our professional membership. We have two types basically. One is our professional, which has been the same all along. It's $350 a year, $32 a month. And then our professional reduced rate. And that encompasses a whole bunch of different kind of professionals. So, you may be part-time, you may be in a doctoral program, you may be, in your first year or your second year. So it's really a kind of self-selected level. So we used to have first year professional, second year professional, third year, and it was a lot administratively and for you. So it's much simpler. We also have a Gold Phoenix member, which is $1,200 a year, and we get very excited when somebody joins, which we actually had a couple past couple of weeks, and also Jade Circle. So those are just some higher level people who are able to contribute more, but we appreciate all members, and so you can see here. This is when you go to join. You'll just have those options. So also we have our new member checklist, and there's just a couple of items here that I also want to point out. One is that there is a new newsletter platform that we're using, and you may have heard from me because I've sent out a bunch of emails about this. And so what can happen is that emails will end up in your spam. We don't want that, but it's quite common. So you just have to go check your spam and find that email and mark it not spam. And that's basically it. But we have this lovely platform where you can access all of our archive newsletters, and it's going to be a really great resource moving forward. So I think that covers it.
Yeah, thank you so much, Kim. So any problems, so do go to your spam. Make sure you're getting the new email invites. We send out a newsletter every Saturday and bump a few extras in when there's a special deal, a class, or something like what's happening tonight. So okay, speaking of events, and then we're going to get into the legislative stuff in just a second. So we do have a Tuesday night webinar series every month for the year of 2026 and probably 2027, because this program has been so incredibly successful. The second Tuesday night of every month, you can join us from 7 to 9 p.m. for 2 amazing CEU credits. You can attend for free if you don't need credits. So we really have an abundance mentality. Come, join the community. We're here to connect and enjoy talking about this amazing medicine. But if you need CEUs, then we ask you to make a contribution so that we can make all those certificates happen. So you can register for free, no credit, or you can register for credit at hopefully a really affordable price. I know I just renewed my license and I got all of my CEUs through CSOMA, which is just amazing that we offered that many between our conferences and Monday nights. So do join us. We have Dr. Toe is coming in April. We have Josh Margolis is with us in May. Dan Bensky is going to lecture in June. We have Emily in July. Emily Von Erf, who you'll be hearing from tonight, who just joined on the panelists, our social media expert and acupuncture student, so our future generation in this profession. And then we have Dr. Toronto Cutler happening, talking about esoteric acupuncture in August. So do come and join us on that Tuesday night. We keep seeing a lot of the familiar faces. And we have a conference coming up, which is amazing, an in-person conference on Friday, May 1st and Saturday, May 2nd in Los Angeles at Yosan University. Such a gorgeous campus, amazing food. I can't wait to get to Rainbow and have some lunch there. I love that part of town. Dr. Hoffman is with us tonight on our board, and Emily, who's a student there, just doing amazing stuff in that community. So please join us for a really exciting program. We'll include legislative stuff, practice building, as well as a lot of clinical pearls. And we also have a panel discussion all about working in hospitals, the VA, stuff like that for professional opportunities like that. So it's going to be a really interesting program. A big vendor hall, tons of freebies. Of course, our famous Price is Right style CSOMA raffle that happens with all the vendors. So do come out for that fun. With that, here's last year at Yosan. We had such a good time. So don't miss out. Come down, join us there. Can't wait to see you May 1st and 2nd at Yosan. with that, I'm going to turn over the beginning of our legislative talk tonight to Dr. Hoffman. We have four bills to talk about, two that CSOMA is taking a sort of support position on, two bills that CSOMA is taking an opposed position on, at least the board of directors. We want to hear from you what your thoughts are. We want to inform you what our thoughts are, and we want to make sure that we stay active because we have to advocate for our medicine and our patients. It's a medical ethic that we also engage in this type of activity to protect our scope and our patients. So here we go tonight. It's a hot legislative year. Dr. Hoffman, I'm gonna let you guide the way from here. Take it, Rob.
Thank you, Ra. Thank you, everyone, for joining us. It is a hot legislative year. That seems like such a weird thing to say, but it's true. Last year was relatively quiet. We had one bill that we worked on, but this year it seems like there's a lot of stuff moving. The legislative session in California is a 2-year session. So we're coming up at the end of that, and a lot of people are putting their bills forward. And then there's a lot of last minute amendments. So if you ever wonder what your state organization does, this is it. We're in the midst of opposing and supporting various bills. So Ra and I were in Sacramento on Wednesday, meeting with our assembly members, handing out talking points, making sure they understood who CSOMA was. And then Julie and I attended the California Acupuncture Board meeting the very next day. Some of the testimony, somebody just put the testimony for SB 944 in the chat. So if you get a chance, check that out. It's really good. And then the California Acupuncture Board meeting is on YouTube. And I won't say that was very good. That was a very discombobulated meeting with not a lot of good leadership or trajectory. But if you're curious about what happens at a CAB meeting, you should watch that because maybe it will inspire you to get more involved. So SB 944 is a really great bill that we are supporting. We did publicly testify for this one. So this ensures that with our Medi-Cal benefits, that we can still have acupuncture in California. So what's typically happened within the California legislature, it says that acupuncture is a benefit of Medi-Cal only if there are matching federal funds. And this is what we had to fight last year when it looked like there were going to be cuts in healthcare and cuts in the budget. Acupuncture was going to be removed from Medi-Cal. So we rallied, the California organizations rallied, and were able to keep that in the budget. But then this bill came forward with Scott Wiener. So this will preserve acupuncture as an essential benefit as part of Medi-Cal, even if there are no federal matching funds. So we got up, we supported this, we went and spoke with Scott Wiener, and that looks really good. That's going to move from committee. It was unanimous within committee. Nobody opposed it. Nobody offered any even comments opposing it, thank God. And that will continue to move forward. Next slide.
And Rob, I just want to add to that. So
yeah.
This is a good and smart bill. I had lunch today with Lily Chow, who's the Director of Integrative Medicine at the Northeast Medical Service, known as NEAMS. They've worked really closely. So they're a federally qualified health center, an FQHC, that does, they have about 15 acupuncturists on staff and are doing amazing things to deliver acupuncture through Medi-Cal. They worked closely with Senator Wiener on this bill and also protecting Medi-Cal the past 2 years. So I just want to say what's true is we want to support 944. It's not controversial. This is a good thing. It means a lot that acupuncture is part of the California healthcare delivery system. And we don't want to lose that foothold that was cemented into place, at least for now, through the Affordable Care Act. But what's true is we're still going to have, after all of everything we're going to talk about today, we're still going to be keeping our eyes open because the first or second week in May, the governor's going to release his budget proposal for the next year. And Medi-Cal benefits for acupuncture might again be on the chopping block with or without 944 passing. So this does not cement Medi-Cal into the fiscal status of the next California budget. But what it does say is that if federal funds get cut, we can still have state benefits, but we still have to fight for those state benefits. So just that little caveat, right? You might be hearing from us again, pressing the emergency button in May or June, depending on what the governor comes out with as his budget proposal.
Thank you for that. Next slide, please. AB 1949. So under Medi-Cal, a patient can have up to 2 acupuncture visits per month. This obviously is much less than many of us would suggest for our patients. So AB 1949 actually removes the current limit of 2 acupuncture visits, and it's up to the practitioner to determine how often that patient can come in for acupuncture. So the idea is that this bill will help support patient outcomes, making sure our treatment dosage is adequate, and it supports, of course, continuity of care, and strengthens acupuncture, quite frankly, as a cost-effective non-opioid option within Medi-Cal. So, of course, we're also supporting that. The bill reading was we didn't have a bill reading last Wednesday for that one, so we weren't able to give public support. But as that comes up, if it's appropriate, we will go and offer our support. If not, we'll be working kind of the emails and the letters as well. So that one, again, we support that. And this is a little slide about Scott Wiener. Ra, you've had a kind of a longer relationship. Maybe you could speak on Senator Wiener.
Yeah, I'm just, really impressed with this senator. He, his constituents are in San Francisco City. So there's a lot of acupuncture happening there and a very robust Chinatown being represented as well. And he actually just released a great video getting his first acupuncture treatment. He testified last Wednesday when Rob and I were there about how he's had something going on, maybe some tennis elbow or something else, and got acupuncture. And he said, and it was better after one treatment. So he's really investing his political force to champion our medicine. So if you're in San Francisco, this is one of your senators, and he's doing a lot of work for this medicine. So it's great to stop by his office in the city and say, hey, thanks, or call his office and say, thank you for what you're doing to support acupuncture. He's been there for us time and time again when Medi-Cal benefits are being threatened. Last year, as the head of the budget committee, he was very, very involved in making sure acupuncture benefits stayed in place. So we owe a lot to this young senator. We want to support him. He gets us. He understands the impact that this medicine has on improving the lives of Californians, especially some of the folks that need it most: low income, manual workers, right? People in the cities. So he's doing a lot to support this medicine. So I just wanted to show you, go to his website, especially if you're in San Francisco. Scott Wiener, Senator Wiener, is your senator. You're his constituent. Your voice matters more to him than, if you're a constituent, than any organization or anything else, actually. He's there to represent you. So let him know he's doing a great job.
Thank you for that. Which brings us to AB 2668, which is if you are on social media at all, you've seen the hubbub, you've seen kind of the busyness. ABB 2668. We are, at least as an executive board, we're opposing this. So this is a bill that originally in its earliest incarnation, late last year, early this year, was really just an administrative bill to kind of solidify some changes in the statutes around acupuncture. And then in the last 10 days, we've started to see this amendment built into, and the language around the entire bill has changed. So this is what we went up to Sacramento last week to voice our opposition to. So the proposal is to eliminate the master's degree from California, create a minimum degree of doctorate for entry level into the profession, to actually create another doctoral title as part of your licensure. So you wouldn't be an LAC anymore. You would be a doctor, yet another title. So now we would have MAC, MAC, CHM, DAC, DAC, CHM, DACM, DAIM, DAOM, MSAC, MSACCH. You got the point. There's a lot of degree titles. And a licensure title is not portable. You may have seen like other people use like Dr. Fred Smith, and in parentheses it says like Rhode Island. So the title itself is not really portable. It's just an in-state licensure degree. The issue with this, first of all, we know the minimum hours right now for California is 3,000 hours. Most of our programs clock in between about 3,000 and 3,500. The issue with this is there's no data that says more hours improves patient outcome, improves patient safety. And the big change is what's happening federally. As of July 1st of this year, through the RISE and AHEAD committees that were created as part of the congressional budget last year, financial aid is being capped as part of master's and doctoral programs starting July 1st. And the Grad Plus loan is completely going away. There will be no replacement for Grad Plus loans. So this increase in hours is coming at a time when students are going to have less access to financial aid and the ability to actually pay for programs. So nationally, ACOM and some state organizations are actually pushing to, there's a few ideas around improving educational quality without increasing hours or even without attaching hours to it. So the hours at ACOM are 2,625. The hours in California are 3,000. We're already 475 hours above the national standard. The idea that we would need to add hours, there's no data behind this. Like, what are those classes going to be? Are they hands-on? Is it clinical? Is it simply adding didactic hours as part of our overall training? There's no benefit that we can see. And again, we'd be moving against the tide of the rest of the profession, essentially. So we're opposing this for now. And I think the next slide has a little more data on it. Can we go there? Yeah, so this just, again, mentions Grad Plus being eliminated, loan caps tightening. So the idea that we would now increase the cost of acupuncture education, delay our students' entry into the workforce, increase their debt, we feel it will result in fewer students, fewer practitioners, and reduce access to care for patients. And quite frankly, it will close schools. With the new federal regulations that are coming into place, most third-party analysts and the Department of Education predict 98% of acupuncture schools will close. And if California moves up to the 3,300 hours, this will disproportionately affect California schools. If you can get if you can get an acupuncture education for less than 3,000 hours faster and cheaper, why would you come to California? So we're working with the group. We're actually meeting with them tomorrow, the group that has proposed this. And we're trying to essentially talk them off the ledge to get them to move away from 3,300 hours. We've also got a petition going around to the students, and maybe I'll hand that off to Margaret so she can talk about where that's at. That's on the next slide as well.
Hi, my name is Margaret. I'm in my first year at Pacific College in the doctoral program, and I just joined CSOMA earlier this year. So excited to be here, and I am essentially here to represent the students and sort of loop them in when things are happening. And so that happened this last week. We found out about this bill, and we put together a letter pretty quickly and sent it out to our networks. And when I made this slide last night, we had 235 student signatures. We're up to, I think, over 240 as of right now. So it is slowly making the rounds, but majority from Yosan, Pacific, and Dongguk. So if you have any other networks or plugins to student networks that you could share it with, I believe the next slide has a QR code that will take you directly to the survey or the student letter, and it's just a Google form that people can sign. So any sharing of that would be really helpful to get as many students signed on and aware as possible. Another thing I found out through sharing this is a lot of students are not very aware of CSOMA. And so even just getting them aware of what CSOMA is doing to get more eyeballs on improving the profession and protecting it as we go forward would be great.
Thank you for that. And there'll be a lot of questions, as to like Why would we propose this? Isn't more education good? Wouldn't a doctoral title be helpful? It just came up. Thank you, Brian. So we already have doctoral titles, right? We have these as part of our national accreditation. We have a DAC, we have a DACCHM, and we have the DAOM. So a licensure title doesn't really help us in that respect because it would only be California and it's not portable. The other kind of issue is the reasons behind this. The group proposing this has suggested that a doctoral title would somehow bestow upon us Medicare benefits, that there would be higher reimbursements from insurance, and that maybe more jobs would open up at hospitals and the VA. But if you've done any, kind of research on this, none of those things actually require a doctoral title. What they require is NCCAOM certification when it comes to the VA. Medicare is a rewrite, right, of law, and has nothing to do with doctoral titles. So it just seems like we're pushing this thing, more hours and a title, when we've already got a title. The whole profession is moving away from hours. I can tell you now, having been on the ACOM Standards Committee for the last 3 years, healthcare in general is moving away from hours requirements and moving into competency requirements, right? There's a thought within all higher education that mandating specific numbers of hours doesn't guarantee quality education. So we weren't able to write it into the current ACOM standards that were just released in February, but they're going to continue to work on it to see how we can develop competencies without hours requirements. And that is the move in all healthcare, and it should be where the acupuncture profession goes.
Yeah, I want to add to that. And Rob, thank you. You really are the perfect expert to talk about this as the president and CEO of YOSON, and also having sat on our national accrediting body for years now. What we want to make clear is there's two differences. There's a licensing title that's bestowed upon us by the state. And in California and in many states, that's licensed acupuncturist. It's not that title in every state, but that's the overwhelming title that we see as our brand or our licensing title in most states. Then there's the educational title. Right now, you can get your licensed acupuncturist title with a 3,000-hour program. And if you want that doctoral title, you can do a 300-hour completion doctorate. A lot of those completion doctorates are around 300 hours or so. And then you have an educational title as doctor. Now, a licensing title given to you by the state, that's not portable. What Rob's saying is if you train in California and you get your license in California, and now you're called a doctor and you want to go practice in Massachusetts, you're not a doctor there. But if you get your educational title as a doctor, that goes with you wherever you go, right? So just to be clear, and so we don't need to do both. We could actually open our scope right now and change it from being licensed acupuncturist to doctor without adding more hours in, right? So we just want to point that out. There's a lot of different pieces moving here, and some affect us more than others. What's true is having a national standard would be the most helpful thing to open up the national healthcare system and to become providers in there, which is going to take a law change at the national level for us to be able to directly deliver Medicare benefits. A national standard, the NCCOM is what's required for VAs and for most hospitals, whereas they don't care. I work at UCSF. I'm the director of integrative medicine there. They don't care if I have a doctor title or not. They want to know that I have met my state licensing requirement, whatever that is. So, there's a lot of myths. I think a lot of people are feeling the existential threat to the profession, but more hours and a change to a title is actually not addressing the problems right now. We could revamp education. I would love to revamp education and see more talk, like include dry needling language and training so that we can claim those codes and make sure we're the experts on that. I would love to see residencies in hospitals. We're launching a fellowship at UCSF. I'd love to see that program grow. I'd love to see us in partnership in education delivering Medi-Cal acupuncture in community clinics. There's a lot of ways we could retool this, but AB 2668 does not do any of that. It's only going to stress students out more and all these schools are going to have to change their programs with administrative staff. They don't have time to do this while they're trying to navigate this incredible crunch in student loans. We have to rethink this, and we have to be more flexible than ever as a profession and laser focused on what is going to keep us surviving, because the threats are monumental right now. So do we like the idea of a doctoral standard? Yeah. Do we love the idea of reconsidering education? Yes. Do we like AB 2668? The way it's written and right now, not at all. So we're trying to explain that to you because there's a lot of misunderstandings of what this bill is actually going to accomplish. And there's a lot of like, well, then we can be PIs, primary investigators in research. Nope, doesn't change that. Then we could get more jobs in hospitals. Nope, doesn't change that. We'll get more respect. Nope, not necessarily. What gets you respect in a medical system is the ability to bill and generate revenue. That's why surgeons get the parking spots closest to the hospital. So, so it's not about any of this, and it's all nice thinking, but it's not evidence-based. It's not true. So it's great wishful thinking. And this bill cannot move forward without injuring students in schools at the most tenuous time that we've seen in decades.
Kate asks a good question. If there's elimination of the masters, how would that affect practitioners that hold LAC status and are not currently at doctoral level? I can't remember how that was addressed in the bill. If I'm remembering correctly, those that have masters or LAC would be grandfathered into the doctoral title. Am I remembering that correctly? I don't want to misquote it, but
I think if the title changed, that you would be grandfathered in. So if you have a master and are licensed, I imagine they would write some clause to grandfather in. Now, the way things work is these bills, so AB means assembly bill. So this bill first goes through the assembly and it's proposed through the education committee in the assembly. Then it goes to the education committee in the Senate. Then it goes to appropriations committees to figure out the financial impact it would have. Then it would go to the governor to be signed. So then once the bill is written, then the California Acupuncture Board creates the rules and regulations that they enforce to make sure that the law is being followed. So there would be more steps to this. All we know is that it basically spins our wheels at a time where we need to be fighting against the PTs and dry needling, and we need to figure out how to support our schools and students through the student loan crunch. So this bill is being proposed by, right now, the California Acupuncture Coalition, which we were a founding member of and very active in participating in. It's a group of a couple of the major organizations. CSOMA stepped back over some disagreements like this. This is not something that we could move forward with. And some groups were not open to hearing why. So, we agree on a lot of stuff in the state, and then we disagree some of the different groups. So yeah. So anyway, we'll see what we can do. We're working in front of the scenes. We're working at Sacramento. We're working behind the scenes. We're getting petitions going. We really just want this bill paused so we can focus on the dry needling stuff, which is what we're going to talk about next. So any other last thoughts or any other comments, Rob?
Nope. Brian brought up the most important thing. I'm more worried about the PT's power grab, as are we, as we should be.
Let's get to it. So we're going to move on from AB 2668, but I got to tell you, the PT thing and the dry needling, that concerns us for existing practitioners. But this bill, what you need to understand is it could even more rapidly close our schools. And then if schools close, schools are the ones that fund our national accreditor, ACOM. If enough schools close, ACOM, which is a nonprofit as an accreditor, doesn't have a budget to keep going. Now we lose our national accreditor. Naturopathic doctors are going through this right now. Now we lose our national accreditor. And now any school that doesn't have regional accreditation is no longer accredited to do degrees. So basically what happens is it's a souffle and we open the oven and everything collapses. So don't think about it as like, oh, fewer practitioners, more patients for me. 2% of the US population use Chinese medicine. We have an untapped market in front of us. So we're not in competition with each other. We have to work together. We're trying to avoid the collapse. So this bill, even though it seems less stressful, is actually incredibly threatening to the profession the way it's written right now. Let's move on to the PT stuff because, oh boy, do we have 4-alarm fires happening everywhere. All right, here we go. I'm going to turn over to Dr. Julie Tran, our president.
Hi, everyone. Thanks for joining us this evening. So basically, Assembly Bill 2497 is framed as modernizing the scope of the PTs, and the language that actually exists is what's on the screen says. It grants the licensed physical therapist authority to use doctor of physical therapy because that's their degree title. Now every physical therapist is a DPT. Expands their scope to include the prescribing non-opioid for that. The one that we really care about is letter C. Allows for tissue penetration for the evaluating and treating of the neuromuscular system. This is their crafty way of saying dry needling without saying dry needling. Okay. And of course, we know that we can move on to the next slide, right? Why this matters is currently California law does not allow physical therapists to perform dry needling. Dry needling basically uses our needles, so that's acupuncture. And the main thing is our training and patient safety concerns, right? You all know, we do thousands of hours of training, hands-on training, theory, right? PTs don't necessarily have to do any training. We had the risk of pneumothorax, and that's the reason why we can't allow the power grab that's happening, even though how crafty or sneaky they want to be about it, because it threatens patient safety. It also confuses the public as to, well, what's the difference between acupuncture and dry needling? And I think Ra, last year when you went with we did the CAC lobby day, right, for Medi-Cal, you met one of a senator who said he was getting dry needling or something.
Yeah, it's so funny because when we did the lobby day last year, so CSOMA participated in a full lobby day on, I think, April 14th last year. And at that point, we didn't have any immediate bills to oppose. So we basically did an FYI and met with a bunch of senators and assembly members. And one of them, who actually sits on the health committee, said, "Oh yeah, I get dry needling all the time." And I said, "Oh, from who?" And from my PT. And I said, "Is that happening in California?" And then they said, no, I go to Nevada to get it." And I could tell that wasn't maybe what's really happening. So there's plenty of illegal dry needling happening. We know that athletic trainers were doing it even at Stanford. And one of our former board members called the sheriff in to report that as a medical malpractice. They immediately stopped doing it and hired an acupuncturist for the Stanford Medical Center. But this is happening, right? There's tons of dry needling already happening in the state. And basically, this bill paves the way for PTs to start providing acupuncture. And not acupuncture. We know it's not acupuncture, but they're going to call it. It's all a slippery slope there. As soon as they puncture a lung, you know what the newspapers say. Acupuncture causes pneumothorax, right? That happened with a chiropractor doing this a few years ago in LA or San Diego area. It was a chiro, untrained, pneumothorax, and every headline said acupuncture causes pneumothorax. So, we not only need to protect our future generations, we need to protect our patients and our existing practices because this is really damaging. And we've seen what it's done to the profession in other places. And it's a slippery slope because then if PTs are doing it, then chiropractors say, we have even more anatomy training. We want it. Nurse practitioners, registered nurses, right? It goes, social workers start doing NADA. As soon as this bar gets dropped, that this language that is written into statute, it is written into law, who can do acupuncture and who can't. As soon as someone circumvents that, then the whole dam breaks. And we no longer are the experts of this medicine at a time where, we're being threatened in every direction. We can't let this happen. We have to oppose this vehemently.
Right. And I just want to let everyone know that, of course, we at CSOMA are following this and gathering support to oppose this. But if you want to track it yourself, billtrack50.com, you put in the bill number AB 2497, and you can see what's happening, what has happened. So the sponsor of this bill is Assemblymember Natasha Johnson. She is actually the vice chair of the Business and Professions Committee, and this is where the bill sits currently. It has been amended, and now they are sitting with it because it affects scope of practice. It goes to business and professions. Okay, so if you look at it currently, it's now sitting there with the revision. So they're going to be the business and professions, or the BMP committee will be reading it through. And then if they have no more amendments, they're going to put it to a vote. If it passes, the Assembly, it goes to the Senate. If it passes the Senate, then it goes to, again, appropriations for what is the fiscal impact to the state. And then it will go to the governor's desk for signing if it all passes. But of course, it's not going to pass because we're going to all rally and oppose this, correct? Yes.
Yeah, and I
Okay.
just want to add in, right? So like the California Medical Association, so like the California version of the AMA has told us that they don't want this because this bill also says that PTs can write for NSAIDs. It has a bunch of other things. It's kind of a kitchen sink bill. And this is a strategy PTs have used in other states before, including Oregon, where they threw the kitchen sink into a bill. Of course, the AMA, the state version of the AMA, which is the big dog in the healthcare lobbying world, right? The AMA has the most power. So the Oregon Medical Association, this happened in Oregon, I think it was Oregon, opposed it. And the PT said, okay, no problem. We'll take out everything except for dry needling. And then the Oregon Medical Association was like, okay, whatever. We don't care about that. So right now, the California Medical Association is saying they oppose this. That's great. But we can't hide behind them and think that they're going to take care of it because they're only going to look out for the interests that they're most concerned about, which is most likely prescription rights, even for NSAIDs, even for over the counter. They don't want PTs doing that. PTs aren't trained in that. So anyway, I just think there are other groups that are going to oppose this, but we have to uniquely focus on this language of invasive tissue because that's them knowing that we're savvy to dry needling. We're bill tracking. They know the term dry needling is going to go bing, bing, bing on our radar. So they're trying to keep the language under the radar and come forward with point injection therapy, right? The broadness of this language allows them to do a lot of things that we should be doing, point injection therapy and trigger point work and also dry needling. So this bill is hugely problematic. We have a guest here. Is this a good time? Yeah, I would love to invite Stace Nelson Hicks up. So Stace, I saw you on Facebook and I saw the work that you're doing to organize. And it was just such a great example. Like I've worked in the UC system. I'm at UCSF. We have recently as acupuncturists, there's almost 50 of us. We have joined a union. We work to unionize all the acupuncturists, massage therapists, and integrative providers in the UC system. And what I learned from the union is, and that I know from CSOMA, is that it takes all of us. It's what all of us are doing. It's not pointing the finger at the 8 of us that are volunteering to be here. It's the whole community. And Stace, when I saw what you were doing on Facebook, I was like, please come and talk about what you're doing. Please talk about your efforts. And thank you so much. So I want to turn it over to you so you can inspire everyone and talk about what you're doing to defend against AB 2497. Thanks for being here. Oh, you're muted. Your audio is not working. So let's see. Hold on. Turn your audio on. You might have to enable the audio. And I know there were 2 links for you. Try again. No. So it might have been when you first logged on. Do you want me to invite you up as a panelist from the other version of you?
She should be good now. Trying
Okay,
again
hold on.
one more time.
I'm going to ask you to unmute. Go ahead and unmute, and I think it's going to work. Go ahead.
Okay, can you hear me?
Yes, we have
Okay,
you.
good. I'm a little echoey. Oh, very echoey.
Okay, hold on. If you have 2 sources open, you need to close one.
I should not.
And we're all going to mute. I'm going to mute too. Just let me get to my mute button.
Okay. How's that? No, that's really bad. I don't have anything else open.
You don't have anything else open?
No.
You have earbuds you can plug in?
No. I'm really old school, so sorry about this. I have no idea.
You know what? Can you hang up and log back in and see if that changes things? And we'll just pause for you because we want to hear what you're doing. You're doing such good stuff. We're going to keep talking, but we're going to wait for you as soon as you get back, okay? All right, so we're going to let Stace come back. Those tech problems can happen, but I promise you, go to Facebook, look up Stace Nelson Hicks, and you will see she's posting in every acupuncture setting and really doing inspiring work. So hopefully Stace is going to come back in a second. So I'm just going to go back to here. So Julie, any last thoughts on this piece before we hear from Stace when she comes back?
Write to your assembly person. Especially if Natasha Johnson is in your district. And the way you do that is the slide that we'll find your representative. If you are her constituent or your patients are her constituent in her district that she represents, it would be great if they call in to say they want her to oppose AB 2497, even though she is the sponsor of it. If she hears from more people in her district that they're opposed to it, she might change her mind.
If you look in the chat, we're putting a ton of resources in there for action that you can take. This meeting isn't here to commiserate with each other. This meeting is here to organize action. So if everyone takes one action from this meeting, we can, hopefully start to change the course of some of these threats and get them back in the right way. So I see, there's links here to everything that you can do. And Kim, did you put that link in? Kim put in a link to our newsletter archives. We're sending out information every week about where you can click, what language you can use so you don't have to write your own letter. We've written the letters for you, who to call. It's great to pick up the phone. They're so nice. Really, the staffers are very nice about these things. They're very gracious. It's their job to hear from us. So look through the chat and get these resources, grab it, go open up a link, and then take that action as soon as we hang up today. Don't wait. Take the action right now. Call, leave a message, write a letter, take 10 extra minutes at the end of tonight to take this action. It makes a huge difference.
And if you only have a few minutes to do it, we want you to target the Business and Professions Committee because this is where the bill is being heard.
Okay.
Okay. So we want those people, we want to target their offices, not only in Sacramento, but their local office. Your representative that has the local office down the street from you or wherever they are, go to their town halls, go to their coffee meetups and say, I work in your district, I live in your district, I would like you to oppose AB 2497, I would like you to oppose AB 2668, whatever one, right? That way we can have a strong, so that when they're reading the bill in committee, they realize that a lot of people are against this, and that way they'll vote to oppose.
Great. And we've got Stace back. How's it going, Stace?
A lot better. I'm so sorry about that.
Thanks for being here. And please let us talk to us about what you've been doing and why.
Terrific. All right. So my background is in public relations and television production. I was in school in the 90s. I went to Emperor's College. Back then, I knew how important it would be for us to actually have media campaigns. We have no money to do that. But we have to do guerrilla marketing this way. So what I have done is just taken really my anger at all of this, and it has fueled me with a little bit of caffeine. And I want everybody to realize that these people who are voting actually work for us. We pay their salaries. You should not be scared to talk to them because they have their jobs because of us, and they're supposed to represent us. So with that in mind, I just pick up the phone and I call them. In fact, I live in Ventura County. I have already met years ago during pre-COVID and during COVID with any elected official about this particular bill. We knew it was going to be coming up. I've already met with them. I've already had connections with them. What I did was write another letter, and I put it in an email to every single one of my patients. And I emailed it to my patients and I said, all you have to do is copy and paste this and send it to Steve Bennett, is our assembly member. Jackie Irwin is in Thousand Oaks, not necessarily where I live, but I have a relationship with her from before. And when her office said to me, oh, you don't live in our zip code, I said, oh, she'll be running for Congress next year, won't she? Because she needs my vote to become a congressperson. So she's going to take a meeting with me. I have tried over the years to gather acupuncturists together. I call it herding marbles. We are so spread apart and so far away from each other, and we're all in private practice. We all have families. We have other things that we need to do. We're trying to keep our heads above water with this very strange career that people don't understand. And I feel like we need to educate everyone on this. So what is the point? I wrote this letter. I gave it to all of my patients. I know that I have at least 40 people who have sent an email already to Steve Bennett. Unfortunately, he's not in this business and professions panel, but he's going to talk to his colleagues, and 40 people from his little county have already gotten to him. Jackie Irwin happens to be on this committee, and I will absolutely have her ear on this. And here's something a little sneaky, and call it whatever you want, ethical, whatever. I already called Mike Berman's office and I told him that I was representing the Palo Alto acupuncturists. And I left him a message saying, this is, you need to not vote on this. This is why. And I did my whole rambling thing for him. I didn't leave him my phone number. I didn't leave him my address. I just said I was representing the Palo Alto acupuncturists. He has no idea who I am or where I called from. I did the same thing to Natasha Johnson. I just picked up the phone and said I was representing the Moreno Valley acupuncturist, because truly I was. And because I don't know if anybody from Moreno Valley picked up the phone and called these people. So I don't care. I will do stuff like that because that is what I used to do for a living. I could cold call anyone and talk to the press. It's really easy. You do have to understand that these people work for you, right? They would not be sitting where they were if you didn't vote or supply their campaigns money. I think once we get through whatever this becomes, my dream for our profession is that we actually all do unite and spend money educating the public. I mean, they did it with Got Milk. I hated the campaign. Whoever's out there, I'm so sorry. When they opened modern acupuncture and it was like, let's tingle. I was like, I am not a stripper. I am a doctor. Terrible campaign. But we need campaigns like that where we have billboards, where people understand what our role in the healthcare system is. And what we actually practice. No one understands that. I've been licensed 26 years and I still have to educate people on what this medicine is and the role that we play in the healthcare system. And so I think we need a portion of whatever organization who does public outreach and reaches everyone in the state, because we have 13,000 of us. We've got the biggest number, right, in the United States. We have to join together and make that a big push, whether you're practicing, whatever, whether it's esoteric, whether it's sports medicine, whether you do dry needling or not. We all really need to be a cohesive voice, because without a cohesive voice, it's just going to look like me yelling into the void at an assembly member. And even in my own county, in my own city, I could not get people together to help me go meet with my assembly member because one person looks like a crotchety old lady. But if there were 10 acupuncturists, we would be able to make an impression on them. I could not get anyone to join me except I have an associate who works with me. She was the only one who agreed to do it. And it was probably because she's my employee, right? And even I have another employee now. I asked him the other day, did you send that letter? Oh, I haven't gotten to it yet. That is the problem. He's my employee and he didn't even do it. So we all have to take this action. And I know none of us have the time, but we're going to have a lot of time on our hands if we don't act now, because the physical therapists are going to be the ones who can charge insurance. And then the patients are going to be like, my insurance covers dry needling. So I'm already in PT. I'm already there on his table. I'll just let him needle me. And I want you to know that I personally have shut down two people who were needling without a license. I called the state board and I got them fined because I will not put up with this. I still have a student loan, okay? And you guys, whoever's out there who's newer, you have a student loan that is much bigger than mine ever was, because it was only $95 a credit when I went. And it's nuts if we let them just walk in on this. And that was one of my questions. Why are we letting them needle with 50 hours when they're asking us to now get hundreds of hours more? And
Yeah.
I don't understand. Where is that?
Part of our group's saying we need 300 more hours to do this safely, and other groups are saying, I can name that tune in 24 hours in a weekend class. Josh Margolis was just plugging in that he knows a lot about this, and so. Yeah, so we're going in two different directions. Neither are good for us. We need to bring it back in. And Stace, thank you so much for sharing about all the work that you're doing. And for me, it was just like you really walk the talk. And so not all of us can go meet with our senators, but I recommend you do. It's amazing to be part of this process. This is how our country maybe has gotten a little off the rails right now. We can't just show up once every 4 years and vote. We've got to be engaged in everything. We've got to be engaged in this process to protect this medicine for our patients. And I'm seeing a lot of questions in the chat about do you have a script? Who do I call? And Kim is directing all of us back to the archives of our newsletters because we're sending this out every Saturday to you guys. We don't have time to talk to each person individually. You got to come to the newsletter to get the updated information. So we'll see what we can do to keep getting that information to you. We have sample scripts for calls or for letters, sample letters, as well as how to figure out who's on the education committee, who's on the health committee, who's on the business and professions committee, the B&P committee that oversees the California Acupuncture Board. Those are our three most important committees right now: education, health, and of course the budget committees as well, and then the business and professions committee. So all right, I'm aware of the time, so I want to keep going through the last few things. I just want you to know, Stace, again, thank you so much. I'm going to keep you up here because you might get questions if you're willing to stick around. Okay. Okay. Yeah, I just muted you for a second so we don't get any feedback. What we've got up on the screen is this is just, CSOMA worked really hard along with Dr. Jenny Nieters, who's been a really strong advocate for dry needling standards and acupuncturists. And we released this position paper, a public statement when this dry needling injury happened that was very, very public, right? So we're always trying to make everyone aware about what's going on. And we take a lot of time to write these papers and get them distributed and get them out to decision makers and stakeholders. So this is something we were working on. Everyone's getting ready for the holidays. We were working on this public statement on behalf of the profession. Look at the bottom, copy that link or type it in or take a picture. I don't think I have a QR code here. I don't have so many screens open, but find your rep.legislator.ca.gov. You just plug in your area code and it will tell you who your representatives are, your assembly members and your senators, and how to find them. So remember, your personal one is important, your personal assembly members and senators, as well as health committee, education committee, and the business and professions committee. That's who we're targeting with these oppose and support bills. I want to hand it over to Mish, one of our new board members. Mish, welcome. I'm going to ask you to unmute. And are you in another country right now?
No, I just got back today.
Oh, you're home. Okay, welcome home.
I'm a little jet lagged.
Thank you for being jet lagged and making this meeting. And Mish, if you could introduce yourself and you're a new board member, we're so thrilled for you to join the team. Thanks for being here tonight. I'm going to turn it over to you.
Thank you. Thank you, Ra. I decided I wanted to join CSOMA because I've been watching what's been happening in our profession. And rather than be pissed off about it, I wanted to be able to put my energy into something productive. So, and I just want to say that when I went to Empress as well, I graduated in 2001 and I've been licensed since then. And when I graduated, and for many years now, no one suggested that I should join a board. It was sporadic. The information wasn't that, it wasn't present. And I agree entirely with you, Stacy. I agree with you, Ra. I agree with everybody on this board and who's been speaking tonight that what we really need to do is bind together and support a profession, because we're talking about supporting our present. We're talking about supporting our future. CSOMA is a wonderful organization. Look at everything that it's doing. If we pull together, it doesn't matter whether you're a student, it doesn't matter whether you're a recent practitioner, it doesn't matter whether you've been in practice for many, many years. We really need to pull together. And I know how independent all of us are in terms of the way we think, in the terms of the way we want to live, in terms of the way that we love to work with our patients. And we really need to create a present and a future for ourselves. So I'm here to advocate that everybody join CSOMA. I would like to inspire everybody who's here on this call, if you're not already a member, and also to consider always being a member, not just because something came up. And CSOMA has the ability to help with communication, help our awareness. That means that we have more choice in these matters instead of something happening to us. We have a voice. I know that we're all different. We have many different nationalities. We have many different points of view, but let's pull them together, because how would anybody really know how everybody else felt if there were no way to voice those opinions? And that's why CSOMA is here, and we're here to protect and to enhance our profession. Imagine even enhancing our scope in the future, let alone protecting it. So that is why I wanted to get on this board. I'm learning as much as all of you guys out there. Many of you probably know more than I do, but I am here to learn, and I will put everything into action. And I want to invite everybody, and I'm here to support you and to help you in any way that I can. You know, the membership is not only very reasonable, it's very powerful. Think about what the chiropractors are doing. Think about the American Medical Association. What if we had that power? What if we could afford more lobbyists? So that's what I wanted to share.
So helpful. And thank you so much for the commitment of joining the board. We do have one student position open and a professional member, as well as an associate member, someone who's not a practitioner. Sometimes it's like someone from herbs or malpractice or other professions that are here to support us. But if you're so into this fight and this type of action that you want to join us, we meet every Tuesday morning, just about every Tuesday morning from 8 to 9 in the morning. It's a weekly board meeting. We have committees. We break off in groups and do it. We hold live events. If that kind of stuff interests you, going to Sacramento, going to the national meeting, representing California, acupuncturists, then send an email to maybe put this in the chat, Julie, president or info, wherever you want it to go, at csomaonline.org. If you want to join this team, we need everyone on board for this. Some of us have been doing this for 15 years. We love it, but it's great to have more people joining. So Mish, so glad to welcome you to the board. Thanks for being here tonight and for that inspiring, for those words. Hey, Lana Johnson, another new board member. I'm going to hand it to you. We're going to go another 5 minutes, you guys. Thanks for staying on the call.
Hey guys, Lana Johnson here. I'm an alum of Yosan. Still work with Yosan in multiple capacities, including supervision and the externship sites. Just wanted to talk really, really quickly about American Society of Acupuncturists. So this is our national association. CSOMA is our state association. This is our national association. When you join CSOMA, you automatically get enrolled in our national association. Their goals and their agendas are very similar to our own, forwarding research, integration into the broader healthcare system, opportunities for networking with, in this case, not just acupuncturists and practitioners and students from California, but on the national level, growth in our field and advocacy, similar to the issues that we're talking about more broadly tonight on this call, the bills that we're talking about. And they're holding an annual conference coming up in April, which I'll be going to, representing us, CSOMA, and really just all acupuncturists from California. I'll be attending that. Students are also welcome to attend that. They also, similar to CSOMA, have regular CEUs that you can take for credit or without credit. Some really great speakers coming up for the year. And yeah, that's all I really wanted to share. Again, our profession's stronger when we all work together. So every voice, everyone here matters. So spread the word.
Yeah, I wanted
Thanks.
to jump in because Lana and I were talking about this earlier, if you don't mind. But Lana, it's true. We also get discounts when we're buying needles, when we're buying products for our clinics. So There are so many benefits to being a part of CSOMA. And I mean, it's what we want to do. We really want to be strong together.
Right. And I just want to add to clarify, when you are a member of CSOMA, you are automatically a member of the ASA, American Society of Acupuncturists. However, you have to sign up to get the newsletter from the ASA. So you have to go to the ASA website to get the newsletter. Okay. That's
Yeah,
where you
thanks for
get
that.
that. And they are working on federal legislation, so Medicare, and we get information. So Lana will be representing us at the ASA council meeting that happens that Friday before the ASA conference. And during that meeting, we get an update as to what ASA is doing for us on behalf of the profession on the federal level. Not only that, we get kind of share the mind hive. So all the other representatives from the other state associations that are part of ASA kind of share what's working for them, what's not working for them, and what they're dealing with. And when we brought up the AB 2497, a lot of that's how we got information from the other states on what they did to help fight dry needling in their state, and things, and how certain things can be crafted in a certain way. And Amy Major actually testified for us. She is the chair of the dry needling committee for the ASA at the CAB meeting about AB 2497. So it pays. Your CSOMA membership pays for itself. Okay, next slide.
Yeah, and the ASA, we pay part of your so if you join, when you join ASA, part of your dues go to fund the ASA, right? So you join CSOMA, some of those dues, that's how the ASA gets funded, is through your state dues. So if there aren't state dues happening, then we don't have national representation, right? So we have to engage in this way and find a membership tier that works for you. But in all these situations, when we go and say, hey, senator or assembly member, we're here representing CSOMA, they say, well, how many people is that? And so if you're not a member, then we don't have those numbers to count. So it's just, and the same thing at the national level. They're trying to get us as individual practitioners or accepted practitioners in Medicare, right? I mean, there's acupuncture benefits for low back pain. How many patients could you be seeing with Medicare benefits? But you have to do it under an MD right now because we're not officially licensed providers. Our modality is accepted in Medicare, but we're not accepted as clinicians. Do you know why we're not accepted? One of the biggest reasons, because we don't have a national standard. Do you know why we don't have a national standard? Because California won't accept the NCCOM exam. This is something CSOMA tried to remedy in 2018. We put a bill forward. We had a bill in place. We had an assembly bill in place, and part of the profession in California worked against that bill so that California would remain isolated. It prevented us from having a national standard, and that's prevented us from moving into the national healthcare distribution machine. So, again, you're going to see acupuncture being accepted, but not acupuncturists. And that's because we are not active in the way we need to be, except for everyone here tonight, because you're active and you're going to take at least one action after this call. You're going to take an extra 5 minutes and make a call or send a letter. At this point, there's tons of resources in the chat. And if you don't, then just don't go on Facebook and complain. That doesn't change anything. This right here is what changes stuff, is the action each one of us takes, like what Stacy's doing and what she's, conveying to us. So, okay. Lana, thank you so much. Lana and Julie are going to go to Minneapolis. They're going to represent California at the national level. Thank you for taking time away from your clinics and your practices to represent us and everyone in the state and come back with more information about how we can do better. Last piece, Emily, our social media, genius. Thank you for being here. What's going on with social media? How do we stay informed? What's happening?
You survived this whole hour and now you get a doom scrolling break. This is everything that you worked for. Hopefully it won't be too much of a doom scroll and it'll be a hopeful scroll. But Stace, I'm so glad you said what you said about us needing a targeted marketing effort and targeted education. And right now, the best way for us to do that is on social media. If you are an acupuncturist and you are not being active on social media, whether that's about your own practice, acupuncture as a whole, or these important issues that are coming up, you are not doing your full job. And we are working so hard at CSOMA to put together things on our social media that are easy and accessible for you, that have the action steps, that have things that you can share with your fellow acupuncturists. And this is just one of the posts. You probably saw it circulating this week. It's one of our biggest posts of the past year, which makes me so happy that people are sharing it. We also have so many other posts about all the dry needling stuff that's been going on, because we've been tracking that for so long, all the Medi-Cal stuff that's been going on, and we will continue to give you updates and action items as we get them. If you are not following us at CSOMA Online, go follow us now. We are both on Instagram and Facebook, and this post is pinned. It is dead center on our account. You will be able to find it, and if you haven't shared it, please go share it. Next slide. I have the pleasure of being the host of the Yosan University 39 Gen podcast. This is actually my second week of being host, and we decided to have an impromptu episode last week with Ra and Julie and Rob. We all kind of had an NBC breaking news night together where we talked about all of these issues, and we went super in depth, especially about how this legislation is going to affect schools and current students and all of the loan stuff going on. This is an episode chock full of information. Please go listen. It is on YouTube, Spotify, and Apple Podcasts. And also share this to people who did not attend tonight and do not have all this information. This is the touchstone. Like we packed as much as we could into these 45 minutes. Listen to it on your commute, on your hot girl walk. It's all there for you. And yeah, keep following us and keep doing your thing online.
Thank you. Emily's making it as easy as possible. We're trying to generate content that's both informative to you, but like Emily said, stuff that you can share to your social media page. So we're trying to make content that's really relevant for everyone, that hopefully makes your social media work even easier. So, and I'm just loving what's in the chat. This action that's happening in the chat, that's CSOMA. What you're seeing in the chat, everyone sharing, everyone helping each other, sharing resources. That's what we're talking about. That's why we come together like this. Up here, we're just your representatives, but CSOMA is this community. The profession is the community. So we all have to do this. With that, CSOMA is also who it is because of our corporate partners. They're the ones that show up and buy booths at our conferences and give out tons of freebies and join, as members and provide discounts to all of our members. So we just want to take a second to thank them. Our top tiered, our gold partners are Health Concerns Jane app and MIEC. They've been with us for a while. Really grateful. We have silver. I can't even talk this time of night. Silver level. You say that 3 times. We have silver level partners, Suen, Herbs, the AAC, American Acupuncture Council, ConHerb, and so many other corporate partners. Look at these. So if you go onto CSOMA website, you join as a member, you get discounts and promotions with all of these organizations. So our goal is that membership pays for itself. You show up, not only does it protect your profession and your patients and your scope, but this CSOMA community that we all partake in is here hopefully to make your membership dues pay for themselves through the generous contributions of all of these partners, as well as all the faculty who come and teach at a discounted rate for CSOMA, so you can have free or low-cost CEUs. So with that, I just want to say I love this quote. I think it's needed more than ever, but I'm just going to paraphrase. So if you're not a CSOMA member at this point, why are you not a CSOMA member? We need you. We need you in every way. We need you here at these meetings. We need your head count to represent in California and at the national level. So please join. Find a membership level that works. If none of those work, reach out to us. We need you here tonight and really every night in this community. So thank you. I'm going to stop sharing. We're going to take a few last questions. That's our program. We are recording this. We will post it. Kim will be able to get this up somewhere, this recording. So we'll get it up. Kim will share that in the next newsletter. Make sure you sign up for the newsletter. I'm going to stop sharing. And I'm going to just turn it over. We've got some Q&As. Maybe the whole board can help out with this. If you see a question you want to address, come on from the mute and take the question and answer it.
I just want to comment on Brian. He said we should basically go at the PTs and start taking part of their scope. And that's been let's look at everybody that wants to take a piece of our scope and see what we can take from theirs and propose similar legislation so we can get them to the table. I kind of like that idea, but that's my East Coast coming out.
Oh, Lauren, look at Lauren in the Q&A, everyone. Are you seeing the Q&A? Lauren's just submitted my opposition to AB 2497. Lauren, do 26682, huh? Since you're on a roll. Thank you so much. And she says it's easy. Lauren says it's easy with the form letter. So thank you so much. Yeah. And Phil, I met a PT that was performing dry needling, reported it to CSOMA. You can report it to us, but the real action is the board, right? We're not here for enforcement. We're your advocates. We do the best we can when we hear about stuff, but we often don't have the bandwidth to take action directly. We're always going to encourage you to report it to the California Acupuncture Board and to whatever medical board oversees that clinician, whether it's a PT in this case or a chiropractor. And there's not a lot of enforcement that happens. That's why we eventually went to the local sheriff when it came to Stanford University needling their Division I athletes by an athletic trainer, not even a licensed profession, right? So we had to go to the sheriff on that one. We can't do it in every case. We do recommend going to the board or going to the sheriff and saying it's the illegal practice of medicine. Let's see. Anything else in here we need to address? Anything else in the chat? Anyone want to raise their hand and need to say something? Hey, is it Stace or Stacy? We've been going back and forth and I haven't formally met you. You have to unmute though. I just want to make sure we have it right.
It's okay. It's Stacy, but nobody
It's
ever gets it
Stacy.
right.
Okay. Just a great
That's okay.
spelling. Okay.
Yeah.
Thank you. Stacy, you're our special guest tonight.
Thanks
Thank you
for having
so
me.
much. Yeah, for being here. Mish and Lana are new board members. And Margaret too is a new board member. So, thank you so much for bringing in all this fresh energy and vision and action to our board. If you want to join this team, it's a lot of work, but we are a good team. We take good care of each other. We're doing important work. If this is something that interests you, reach out to president@csomaonline.org. There's a lot in here. I'm going to leave this up for another 5 minutes. So even if people are signing off, I'll leave all this here so the chat stays so you can all scroll back through it and make sure you take all the links that you need. Go sign up. The best actions you can take, sign up for our newsletter if you aren't already, and just follow along. Pretty much Kim gets it out every Saturday or so. We'll keep you up to date on items that we need to take. And remember, after these 4 bills, we still have to deal with whatever the budget's going to come out with, or the governor's going to come out with the budget in May. And we'll probably have to rally around that. So, let's just this is just like training, legislative training. We got to keep training. So everyone, it's 8:20. You've stayed 20 minutes longer than we asked you to, and we already asked you for 60 minutes. And we want to ask you for another 5 minutes to go take at least one action from everything in the chat. Go make one call, leave a voicemail, send one message right now, send one email, and help us protect the scope. And thank you for being part of the CSOMA community. Hope to see you on the member side. Hope to see you in a week from, 2 weeks from tonight at our next webinar, and hope to see some of you in Southern California, May 1st and 2nd at the gorgeous campus of Yosan University for our in-person live event.